Patois as the chair of the Integrated Joint Board, replacing Councillor John Cook, who then might want to say a few words. So make sure we know.
Thank you very much, Chair, and good afternoon, one and all. I think I know some of you, and if I don't know some of you, I hope to get to know you. It's a real honour and a privilege to step in for John, Councillor Cook, as a representative from the Aberdeen City Integration Joint Board and the wider Health and Social Care Partnership. I'd like to put on record my thanks to Ms Crombie for the very insightful and informative briefing she gave me a week ago. However, I'm still terribly new to this. I freely admit I'm not as versed in this area as I should be, so hopefully, Chair, you'll be kind to me for my first meeting, but I do look forward to contributing where I can. And if there's anything I can do in terms of the linkage between this board and my other role, I'm very happy to do so. And thank you, Chair, for the welcome.
I see what you're doing, putting low expectations that you are sure to exceed. It may be a good idea for all of us to say who we are, how we do we represent. I'll start with myself, Christian Allard. I'm the Councillor Christian Allard, the chair of the Committee Planning Aberdeen. On my right.
Susan Webb, Director of Public Health, and I'm the Vice Chair.
Hi, Anthony Standing, Head of Operations for Skills Development Scotland in the North.
Hi, I'm Councillor Kate Blake.
Councillor Miranda Radley, hi.
I'm Martin Gregg. I'm a member of Aberdeen City Council.
I'm Alison MacLeod. I'm Lead for Strategy and Transformation for Aberdeen City Health and Social Care Partnership.
Just for completeness, Hussein Patwa, the rep from the Aberdeen City IGP. Thank you.
Hi, Gillian Evans, Head of Health Intelligence from NHS Grampian.
Hi, I'm Gogo Kafo, Aberdeen City Council.
Martin Murchie, I'm Chief Officer for Data Insights at Aberdeen City Council.
I'm Graham Simpson, Chief Social Work Officer for Aberdeen City Council and Chair of the Children's Services Board.
Ian Robertson, Transformation Programme Manager for the Aberdeen City Health and Social Care Partnership, but I'm also the co-lead of the Integrated Locality Planning team.
Alison Swanson, Community Planning and Improvement Manager. And Michelle Crombie, Strategic Lead for Prevention and Community Empowerment.
And if we have the people online, starting with Michael Cassie.
Good afternoon, Michael Cassie. I am a Group Commander of the Scottish Fire and Rescue Service. I am deputising for Area Commander Andrew Wright today.
Nick, please.
Good afternoon, everybody. I'm Nick Wright. I'm the Vice Principal for Research and Regional Engagement at the University.
Sorry, could you repeat this? It was very faint. Nick, thank you.
Yeah, I'm Nick Fife. I'm the Vice Principal for Research and Regional Engagement at Robert Gordon University.
Thank you very much. Matthew?
Afternoon, everyone. Matt Lockley, Head of Regional Opportunities at Scottish Enterprise.
Thank you. Kate?
Good afternoon, everyone. I'm Kate Stephen, Divisional Commander for North East Division and Police Scotland.
And Susan?
Good afternoon. I'm Susan Nelson. I'm Regional Chair for NESCO.
Okay, thank you very much for everybody to introduce yourself. I think it's important that we do so. And I remind, of course, that it's a hybrid meeting and some members have decided to attend remotely, and you're always welcome to attend remotely. We'll go into the minutes and forward business. 1.1 is a draft minute of the Committee Planning Aberdeen Board meeting of the 27th of March 2025. Is for approval. Maybe you want to say a word, Ellen Shepherd, our director?
Just to confirm that Eleanor Shepherd, the director, has confirmed that all of the actions under item 6 have been completed and a response was included in the email that went out with the agenda.
Okay, everybody's content with us? Minutes approved. 1.2, draft minute of the Community Planning Aberdeen Management Group meeting of the 21st of May 2025. Is for information. And then we've got 1.3, the forward business planner, again, for information. Any question on either of them? Oh, Susan, yes.
Yeah, I was wondering, just in terms of the forward planner, there's been a lot of invites come out quite recently around some informal education, which looked really fantastic, but diaries get quite busy. So I just wondered if we should give some consideration to blocking in some times that then some of these opportunities could slot into so that we've got some protected time in our diaries to attend. It's just a suggestion.
Happy to look into that.
Okay, everybody happy with the suggestion? And happy with the business planner. So we'll go on 1.4, the Scottish Location Director update. Unfortunately, Richard McCallum cannot make it today for his verbal update. So the board would like for Richard maybe to send us something in writing. Will that be helpful? Can we do that, Michelle? Asking for Richard to send us something in writing will be helpful. And maybe in the future, he might want to send us something in writing in advance, as opposed to a verbal update. Would that make sense for everybody? Yeah, so if we could do that, Michelle?
I think he would normally prepare something in writing if he wasn't able to attend, but it was a last minute apology. So, but we'll certainly ask for that post meeting.
Yeah, I think it would maybe work better if you always have something in writing in advance. And then if he wants to come into the meeting and talking about what he sent us in writing in advance, which is in the paper, will be helpful. Susan?
It was just to say that I'm sure if Richard was here today, he would have talked through some of the announcements that were made yesterday, in particular the population health framework. If it's helpful, I can circulate the briefings that we've had from policy leads just to by way of update to members, and perhaps we could put it on a future agenda item.
Anybody else would like to share anything at the same time, and Susan? No? Michelle, good idea?
Yep.
Thank you very much for that, Susan. So you'll expect to receive an update coming from Susan, which will be good. And we will ask the Scottish Government to reflect on the possibility of sending us something in writing before every meeting to make sure it's in our papers, or as an update later after the papers are published, but just for us to have a base and start a conversation. If he comes to us, it will be easier for us to have something in writing. Like this, instead of a verbal update, we'll be maybe able to have a conversation, which might be a bit more useful than a verbal update only. Okay, so thematic session, priorities for improvement, is 2.1. So this is the session which will explore the priorities for improvement emerging from the annual outcome improvement report, the locality plan annual report, the population need assessment, and the public engagement. The locality plan annual reports being north, south, and central. Who would like to speak first about Alice? Google will share. Thanks.
So if you can go to the next slide. So as members are aware, we are currently developing the local outcome improvement plan and locality plans for 2026 to 2036. And you can see on the slide there the full timeline for that development process. So the development process saw us start in February this year and will then see us reach the final plans for approval in May, June next year. So you'll see on the slide there that there are a number of areas in green which we have completed so far, and I'm going to touch upon those in the next slide. And then we're going to cover, once we've heard from the chairs today, the further steps in the plan. So Gogo, could you take us to the next one, please? So as you can see on the slide here, these are the steps that we have taken so far to provide the foundation for the development of the local outcome improvement plan and the locality plans. And this ensures that we have a clear understanding of the here and now as to our position. So first of all, here you can see we have our population needs assessment for 2025. So the population needs assessment has been updated to make sure that we have the latest data that's available for our outcome improvement groups to work from in terms of identifying their priorities. The population needs assessment this time has been structured on the social determinants of health, and it's been further enhanced by the addition of a new section by the Public Health and the Health Determinants Research Collaboration, which is a summary of priorities and risks section. And that's to help our outcome improvement groups to identify the priorities for the next plan. So we also have here our annual outcome improvement reports, and that shows us the current status of progress towards our stretch outcomes, but also the progress and status of the improvement aims that are underpinning them at this time. To ensure that we have the voice of our communities at the heart of our plans and that they're informing our priorities from the very outset of the process, we held a public engagement exercise between the 24th of March and the 18th of May this year. And the reports on the results of that engagement exercise are on today's agenda. In that engagement exercise, we had 2,087 people participate, and they scored and also shared their views on what is good now and the areas for improvement across the 14 themes in the Place Standard tool. So our groups are now using the data from the population needs assessment, as well as the current status through the annual outcome improvement reports and the results from our communities on what they've said is important to them to identify the emerging priorities for containing in the next plan. So I'm going to hand over now to each of the chairs who are going to talk you through those emerging priorities by social determinant of health. So on that basis, I'm going to start with Michelle. You're going to cover, oh no, sorry, I'm looking, sorry, Graham, it's yourself.
Wondering if Michelle is going to happily take that slide if you want to. Chair, what I'll try and do is, I'm aware that Eleanor and myself presented quite detailed information to the last board meeting, and I'll try and not repeat that, but inevitably there will be an element of crossover between that presentation and what I'm about to speak about just now. But on the slide, there is 8 sort of emerging areas which we want to focus on around that as well. And in each of them, there's an interdependency as well, so that they don't stand alone in thinking about that as well. But nonetheless, recognising the importance of the best start in life and the first 1,000 days of a child's life. That is from the point of conception through to a child's second birthday. That is a really critical phase in a child's development, and opportunities to fulfil their potential are so much determined in those first 1,000 days. So again, thinking about improved maternal health, thinking about within our deprived areas, addressing smoking within pregnancy, maternal weight and breastfeeding as well. But I think we also have to think beyond that, and thinking also about where do the role of fathers play within that as well, and actually really continue to think about how we ensure fathers are prepared to stand up and take on their responsibility as parents within that as well. Recognising the critical importance of that almost 2.5-year developmental check, that 27 to 30 month check, and ensuring that actually immunisations are up to date and current, that actually we're monitoring that development through the child's progress around that as well. And that timescale also coincides with many children having the opportunity to begin to engage in formal learning settings in the early learning centres and all of that. So that transition from home into some sort of learning provision is a really critical phase that we know is for children as well. Ensuring that they're school ready and all of those aspects around it as well. Preventing suicide and improving access to mental health for children and young people. Whilst the numbers, fortunately, of teenage suicides are still relatively low, or in fact very low, they are nonetheless significant when they happen as well. But recognising that actually the challenges of our community and adolescent mental health services, they are continually stretched as well. But what we also know is that young people who exhibit and experience poor mental health and well-being, there is also a likelihood that their parents also experience that. So I think thinking about that correlation, seeing the child within the context of their whole family remains absolutely fundamental to how we're thinking about this issue as well. And that then links into thinking about that expanding our whole family approach. Members will be aware that we are, Aberdeen City as part of the Fairer Futures Partnership, we are developing our family support model, thinking about that preventative and indeed targeted support that families can access themselves and be referred into is really, really important, mitigating the need for them to require more intensive supports at subsequent points in time. What we also know is that actually, if we improve the accessibility of these services where families can access themselves without being referred by agencies, then we know that they exit from these support services quicker, and the benefits that they receive from that support are longer lasting as well. So how can we really continue to expand that access without making it difficult for families to do so as well? We know that improving destinations continues to be a priority, but also thinking about actually where do attendance and positive destinations really fit within our planning, within our school communities, and indeed, but recognising that actually for our care experience young people, those with disabilities or additional support needs, and those living in our more deprived areas, this is a bigger challenge as well. And I think we also have to think about moving away from simply about positive destinations into sustained positive destinations is absolutely really, really important in terms of that thinking about it as well. We know that that we want to think about further opportunities that actually youth activities that can help reduce antisocial behaviours and young people who are coming into conflict with the law is really important. It's something that is linked to then attendance and engagement within learning as well. But actually, how can we divert young people away from those behaviours, mitigating the need for them to be referred into formal systems around that? So that early intervention is really, really important, and is aligned to very much the aspirations of the promise that we only intervene in family lives where there's a risk, and absolutely necessary as well. Our children and our families have told us that the transition from children's services to adult services continues to feel uncomfortable. We don't make it easy for them or indeed for our staff either. So how can we continue to eradicate some of those barriers to make it easier for those transitions to be managed? And again, really thinking about the whole life of the individual, not just seeing it as child and adulthood. Actually, how do we see that? But we do know that actually with the improvements in medical science, the improvements of diet, that children are living far longer than they would have previously. And so we have a growing number of children with complex, enduring needs that will actually see and go well into their adulthood as well. And it's important that these individuals' lives and transitions are planned for effectively as well. But also understanding how our people in our priority neighbourhoods want to access services. At times we don't make it easy for them through transport links, through the location of services. We know that, for example, there are currently no GP practices in the Northfield area of the city. How can we then begin to think about making it easier for our more priority groups to really access the services that make a difference in their lives, and ensuring that they get the support when they need it without feeling stigmatised at any point in that process as well. So those are some of the emerging issues that the Children's Services Board and its partners will begin to take forward. But again, seeing it not just through the eyes of a child, but actually seeing it through the eyes and lens of a whole family remains absolutely critical to how we want to approach this.
I'll now move to Michelle.
Thank you. Members of the board, I'm covering the economic stability section of the presentation this afternoon because Duncan Abernethy, who's the chair of Aberdeen Prospers, is unable to be here this afternoon. So starting on a positive note, the population needs assessment shows that at this time Aberdeen continues to benefit from a strong economy compared to Scotland and the UK. However, economic growth is projected to slow down between now and 2025 2028, primarily due to the decline in the oil and gas industry. Now, of course, this isn't news to any of us. We know that our past reliance on the energy sector has left us vulnerable to economic shocks, and whilst our economy is still strong, it is no longer stable. So there's a very clear priority that we need to continue to diversify our economy away from the oil and gas industry in a carefully risk-managed way to ensure a just transition and mitigate the potential for job losses. Technological advances and demographic changes also pose a threat to economic activity and employment within the city, so we also need to be vigilant of those. Our focus is on creating new employment opportunities by supporting local business startups and the expansion of growth sector enterprises like renewables and tourism. And offering skills development and training in these emerging sectors is key to ensure these new employment opportunities are accessible to people living in Aberdeen. We'll aim to do this in a way that ensures that no one's left behind, but unfortunately we know that this is already the case and that 1 in 7 households in Aberdeen have no one working in them, which equates to 13,700 workless households. And we know that people and communities experience unequal access to employment, training and enterprise opportunities. For example, individuals from disadvantaged backgrounds and areas are more likely to be out of work. The employment rate for ethnic minorities in Aberdeen is 65.2% compared to 77.4% overall. And a recent study into gender-related poverty in Aberdeen has highlighted the disproportionate barriers women face to securing good jobs due to their caring responsibilities. These inequalities are what sit behind our child poverty statistics, and whilst latest data shows that levels of child poverty are down from 22-23, there are still 5,600 children in Aberdeen living in relative poverty and 7,825 children after housing costs. Continuing to offer targeted employment and employability support for these priority groups is essential to address inequalities and ensure we have an inclusive economy as we transition. This, of course, involves coordinating efforts across public, private and third sector partners to maximise our combined resources and ensure support and opportunities are available to those communities that will benefit most. And I also wanted to emphasise the role of community plan and Aberdeen partners that we can play as anchor organisations in terms of offering apprenticeships, work placements and job opportunities. And finally, of the 5,600 children living in Aberdeen in relative poverty, 66.7% were in working families. Many jobs, particularly in sectors like hospitality, care and retail, offer low wages that don't keep pace with the cost of living, and as a result, we know families are struggling to make ends meet despite being in employment. Last year, it was estimated that 10% of employees in Aberdeen were earning less than the real living wage, and the median gross weekly pay for full-time workers living in Aberdeen is less than the median from Scotland by some nearly £20 a week. So to address this, there is a continued focus on expanding the Real Living Wage programme, particularly in sectors with high numbers of ethnic minorities and young people, and you'll hear more on the living wage from Martin Barry, who joins us this afternoon. Lastly, I wanted to touch on the role of place planning on economic growth and creating employment opportunities. We received a lot of feedback from the community engagement exercise about how empty spaces and buildings could be better used to attract and encourage local businesses, which in turn creates employment opportunities. Also, the importance of the public transport system to enable people to travel to jobs, particularly low-income individuals and those in areas with limited car ownership. So those are the kind of 3 groupings of emerging priorities for economic stability. I'll now move on to communities and housing, please, Gogo. So last year I took on the chair of the anti-poverty group, And I really can't emphasise enough the impact that the cost of living crisis is having on all our communities, but in particular low-income households and vulnerable groups that were already struggling before the crisis. We've just covered how crucial employment is in terms of giving people the opportunity to earn a decent income, and it is the primary way for individuals and family to escape poverty. But I've also just acknowledged that there are groups of people that face significant barriers to work, and in-work poverty is a significant issue for those in low-quality, low-paid jobs. To better understand the impact of poverty on our communities, we gather data through our City Voice Citizens panel. And since 2021, we've seen a year-on-year increase in the proportion of panelists reporting that they've had to go without food, fuel, or other activities due to a lack of money, with the largest increase seen in the proportion of people worried that they can only afford to heat their home or feed themselves and their family. I acknowledge that City Voice is not a perfect data source, but these results are consistent with what has come through the community engagement and what we're hearing from communities direct. And the reality is that for our most vulnerable communities, people are forced to make a choice between everyday basic necessities. The data highlights issues around access to food and fuel. But over the last year, the anti-poverty group has also explored digital and transport poverty, as well as the issues facing people with no recourse to public funds and the impact of gambling harms. And there are many other areas that we will delve into. But there are support services available to local communities to not only address their immediate needs, but also to support income maximisation longer term. And as a community planning partnership, it is our responsibility to ensure service provision across the public and third sector is better coordinated and communicated to the public, either through ongoing awareness raising or direct contact using our local income family tracker. As well as chairing the anti-poverty group, I also chair the community empowerment group, and I am responsible for the locality planning team that works directly with communities in our most disadvantaged neighbourhoods. Since we published our community empowerment strategy in 2022, we have made strides in creating opportunities for communities to participate in local decision making. The positive response we've seen to the community engagement exercise, I think, is testament to that. However, we know that despite our efforts, there is more we need to do to ensure diverse community participation in community planning at a citywide and a locality level, particularly to hear from marginalised groups and people with lived experience. Furthermore, we need to embed community participation in a way that creates opportunities for co-design and co-delivery of services and greater community empowerment, not just engagement. Working with communities also fosters community cohesion, and it can enrich people's experience of local community life. The need to promote understanding among diverse community groups came through very clearly through the community engagement exercise, and therefore a continued focus on supporting communities to come together to take forward initiatives that address local issues can build that sense of belonging and improve well-being. And finally, in the last refresh of the LOIP, we also identified ending homelessness in Aberdeen as a priority outcome, which we are progressing in partnership with the Royal Foundation as part of their Homewards programme. The data shows that homelessness continues to be a challenge, with almost 2,000 people affected by homeless applications last year, including 600 children. We understand that homelessness is not just about availability of affordable housing. It's a very complex issue that stems from a combination of individual circumstances and the broader social determinants that we're going over this afternoon. Through the Homeward Steering Group, we are leading action across the different drivers of poverty and homelessness to address its root causes and improve pathways to housing and support to prevent it from happening in the future. That's just an overview of priorities in terms of communities and housing, and I will now pass over to Gillian.
Thanks, Michelle. Lots of mention there about using City Voice as a way of monitoring change and attitudes. It's really great that we've got that. And great that we've got teams of experts in all of these outcome improvement groups that can use their expertise and consider what's been said through local polling and national polling. So I think that's how the two come together. Neighbourhood and environment, I'm so glad that we're grouping things around the social determinants of health, because it really does show it just shows how holistic all of this is. And I think there's so much overlap probably in everything that each of us as peers will be talking about. Some of the national polling is really interesting. I've been following some of the British social attitudes polling, and it gives you some really interesting results that I think bear out in the way people are feeling in Aberdeen and in our communities and beyond. A lot of it is about supporting. I mean, this is actually quite a change, I would say. Supporting a shift from just dealing with ill health to prevention. Now, I know you might think that's absolutely obvious, but it bears out in the polling stats, and I think that really is important. And I'm just going to go on with a few of these because it's relevant to what we are doing. About supporting bold government interventions to tackle the leading risk factors of ill health. That is important. That's the onus on us as local partnerships, but also as anchor institutions and as policymakers. And the other thing, and this struck a chord with me. The voters or people living in our country want to build action on health and don't see it as want governments to build action on health and don't see it as part of a nanny state. Now, you and I probably have been in plenty of rooms where people say, we can look after our own health. We don't need governments or local authorities to tell us what to do or communities to tell us what to do. But actually, people's views are changing. So I think there is something about mindsets changing, about what we're doing, and a recognition on a much more wider social, economic and commercial, all of those factors that influence health. So where does that get to with neighbourhood and environment? In the Sustainable City Outcome Improvement Group, a couple of years ago, we looked at a place-based approach and put a climate lens on it. And our field of interest was right up to 2045. And of course, we had such big ideas, that you think will never happen in our community. We'll never be able to get there. The steps along the way will be too long and aren't in our control. But I think things are changing. So when we were talking about how can we make places more accessible for people so that they don't need to use their cars, so that they can use their bikes, so that they can walk, so that there are services that are available to them that don't mean they need to travel very far. That's changing. So some of the stuff that's on the slide there, particularly about co-location of services so that people can access facilities more easily in the one place, coming together and reducing car use is a good response to that. And some of these things are practical actions towards that bigger picture. The other thing that's of interest to us, if we're still thinking about reducing car use, I know there's a lot of keen cyclists in the room. Improving the safety of cycling is a real common theme that we get from children and adults. And, part of the frustration will be about our road infrastructure and how difficult it is to cycle in Aberdeen. It's a bit hilly, it's a bit cold, and the streets are a bit narrow. But a lot of this is about building confidence while we start turning around our infrastructure. And you start that off in schools with parents in schools, and nothing gives you more pride than seeing parents taking their kids to school on a bike. I mean, it is absolutely fantastic. So a lot of the stuff that we'll do with schools and we continue to do in the community is really important there, and a good stepping stone to change. Wildlife, green stuff, environment is absolutely at the core of so much that we do in the Sustainable City Group. I don't know if any of you have heard about some of the fantastic work that's been done by the RSPB and their nature social prescribing leaflets, working through a few GP practices in the city, but wouldn't it be great if we could extend that further? These are really heartwarming, fantastic things that help people think about the value of nature and how being outside in an environment is every bit as important or more beneficial. In fact, there are studies that say it's more beneficial for your health than a tablet. So our social prescribing there is really crucial for people's place, for the environment, and for spending on things like prescriptions. I think lastly, just to, well, maybe not lastly, maybe second lastly, is about waste management. And so much more that we can do in terms of reducing the generation of waste in the first place, but also making better use of waste management. And there's a focus there about growing, but also about waste management in schools that we're looking at. And my final bit is just about, here we are sitting in the mild temperatures of Aberdeen, but we know that, and we know that the environment around us is changing in terms of heat, but also in terms of cold. So we want to do a bit more in the cold on resilience, and particularly around things like the ice crews that have been very successful in building a real strong sense of community. People wanting to do their bit. GPs love it. They see it's really practical, and we're starting to see some very promising signs of it being an initiative which can reduce people falling, and that benefits everybody. So that's our work.
I think it's over to me next, is that right? Could we move on to the next slide? Thank you. So the 9 emerging priorities on this slide are focused on addressing the social and economic factors driving inequality in offending, in healthy life expectancy, and in alcohol and drug-related deaths. The first one is using data to identify areas for targeted supports to reduce suicide and improve mental health. Data from the PNA tells us that this focus is needed. In Aberdeen City in 2023, there were 29 probable suicides. 24 of these were male and 5 female. In terms of mental health, in 2019 to 23, an estimated 18% of people were deemed to have a potential psychiatric disorder, and depression was reported as the second most prevalent condition. Dementia and Alzheimer's disease were the leading cause of death for females and the second most common cause of death for males. Our next priority is addressing the behaviours and health risks associated with smoking, obesity and physical inactivity. Over half of the deaths in Aberdeen City in 2023 were associated with cancers and circulatory diseases, for which smoking, obesity and physical inactivity are risks. Smoking during pregnancy can have significant consequences for mother and baby. It links into what Graham was telling us earlier in terms of those early years. This increases the risk of stillbirth, miscarriage and preterm birth. Around 9% of pregnancies booked are current smokers. Obesity rates in 2023 were 32%, a significant increase from the previous reporting period at 23%. Promoting active ageing and reducing social isolation through accessible and affordable activities is our next priority. This is in response to the prediction that by 2028, the number of 65 to 74-year-olds will increase by 14.4%, and the number of 75 plus will increase by 16.1%. And the forecast that if we do nothing, there will be a 21% increase in the annual disease burden in Scotland over the next 20 years. With the current financial situation, we need to try to reduce demand for health and social care services in the future. Another way to do that is to continue delivering condition-specific community appointment days, which help to increase access to healthcare services, support self-management and reduce waiting times. In terms of health equity, an emerging priority is to look at the role of place and whole system approaches. We know that inequity has a profound impact on health outcomes. Healthy life expectancy in Scotland is 26 years lower in the most deprived areas than it is in the least. In Aberdeen, drug-related deaths are more than 10 times higher in the most deprived areas compared to the least deprived. And prescriptions for anxiety, depression and psychosis are almost double in the most deprived areas than they are in the least deprived. Our next emerging priority is in relation to enhancing whole family support to reduce drug-related deaths, increase naloxone availability and improve access to alcohol and drug support. In 2023, there were 54 drug-related deaths, an increase from 42 in 2022, and 23% of adults were drinking alcohol above the guideline recommendations, which is an increase on the previous period. In 2023-24, there were 316 hate crimes recorded by the police in Aberdeen City, up from 291 in 22-23, and higher than the Scottish average. In Scotland, the most common aggravator for hate crimes was race, followed by sexual orientation. 8% of people in Aberdeen City report that they experienced discrimination, and 4% report that they have experienced harassment. To try to address this, we have an emerging priority around continuing to tackle hate crime and support better integration and inclusion of international residents in communities. Our final two emerging priorities are in relation to supporting people in the justice system with housing, employment, mental health and substance supports to reduce reoffending, and introducing targeted safety initiatives to reduce antisocial behaviour and specific crimes and to explore ways to enhance community safety. And that's the health and social care part. Thank you.
Thanks, Alison. Fogo, would you mind going on to the next stage? So we've obviously heard from our chairs in terms of the emerging priorities and the stages that we've completed to date in terms of the development process. So just wanted to cover the next few stages in terms of that process. So as you can see here on the slide, between June and August, our outcome improvement groups are meeting and holding workshops and meetings to look at the data and all of the results from the community engagement to help them identify any gaps from that data and the community engagement, and also start to identify the system level change to support achieving those areas of priority. So to support our outcome improvement groups with identifying system level change and innovation, the collaboration of Health Equity Scotland and the Health Research Determinants Collaboration have been identifying what's working elsewhere. So a list of interventions and innovations have been given to each of the outcome improvement groups. And to support them explore that, tomorrow there will be a workshop held with the collaboration, and that's for the groups to meet in person and to work with the collaboration and the Health Research Determinants Collaboration in order to look through those innovations that are emerging. Thereafter, we are asking our outcome improvement groups to submit their first emerging priorities and as well as their system level change that they're proposing to do on the 13th of August. And that's to enable them then to present those emerging system changes at the Towards a Fairer Aberdeen conference on the 27th of August. And that will really ensure that at that early stage, we're getting feedback from a wider audience in terms of those emerging priorities and the system level changes that our groups are identifying. After that, after the conference, Gogo, would you mind going on? Thank you. After the conference, we will provide feedback to each of the groups, and then we are asking for their initial full recommendations to be submitted in October for consideration by the management group at that time. Thereafter, on the 13th of December, we're asking for the final draft for each of the stretch outcomes to be submitted by the outcome improvement groups. And that will see us have a full draft of our local outcome improvement plan by the end of the calendar year. That will then ensure that we're on track for holding our stakeholder and our engagement sessions on that full draft in the beginning of next year, with us then holding a public engagement on the proposed plans in February, March. That will then see us provide time for our groups to take cognizance of the feedback from the public engagement and then submit the final draft for consideration at the board in June next year. So Gogo, if you could go on to then the final stage. So as per the agenda, we had then had a number of questions for you in terms of consideration of the presentation that you've heard. So Chair, I'll pass over to you and open it up.
Thank you very much. And before we come into any kind of questioning or any comment that would you like to make of what you heard, let me first of all maybe ask Angela to just join us to say who she is, and we've got already said that you already join us because we did that. We did an introduction beforehand. So and I'll ask Sarah afterwards to introduce herself as well. Angela.
Angela Scott, Chief Executive, Aberdeen City Council, and on behalf of the CPP Board, Chair of the CPP Management Group.
Thank you. And Sarah?
Sarah Chu, representing ACVO, the third sector interface in Aberdeen. Apologies for my late arrival.
No, thanks very much. Better late than not coming at all, Sarah. So that's great. Any question and comments that would you like to make? And we've got some line of questioning, which will be important to agree. Do you agree with the priorities of improvement? Is there anything missing? And are you content with the proposed next steps? So it's, as a board members, it's your time to influence as much as possible as well at what is going to happen next. Sorry, Martin Barry had just arrived as well. Martin, you want to introduce yourself?
Yes, thank you, Chair. Martin Barry, Scottish Enterprise, based here in Aberdeen. I'm attending for the Real Living Wage agenda item.
Thank you, Martin. Anybody wants to start? Oh, yes, sorry. Mr. Batwa, go ahead, you said.
Thank you very much. Here goes nothing. Thank you for those presentations. That was really, really fascinating. Absolutely was. I suppose a few generic questions just to begin with. So on, excuse me, on Michelle's point, I just wondered around data, because quite rightly, child poverty is a national priority in Scotland. It does, however, beg the question when you start looking at gaps as to the poverty that are experienced by, and I've very perhaps sillily termed it non-child households, but you know where I'm going with that. I'm just wondering if we have any quantifiable data, if that is collected by the census or others, so that we're able to take that into the mix as well, so that we're not only doing what we can to give our children the best starting life, but also addressing all of those other factors around poverty. Do we actually have the data for that? And I have follow-up questions as well.
Thank you very much, Hussein. Michelle indicated that Martin might be the best place. Mr. Mashi.
Thank you, Chair. So there's a number of different sources of data that we can reach for in terms of poverty at a household level or an individual level. I guess poverty tends to get categorized into different types of poverty, so fuel poverty and food poverty and different types. What we can do is we can bring some of that data together, and we do that. I think Michelle mentioned a project that we've got on the books around low income at a household level. So we have data from DWP, and we can match that and have matched that with our own data in Aberdeen around our housing records, our own benefits records, and various other things, and bring that together at a household level. So we've got very granular data on that. We can obviously amalgamate that, and we do, and we push that up at different geographical areas. So whether that's data zone, intermediate data zone, or postcode level. So we've got a pretty good picture of poverty in Aberdeen and where that is and what the types of poverty are. There's some complexity in that, and again, Michelle talked about in-work poverty, which can be hidden. If we look at things like the SIMD, the social indices of multiple deprivation, which is the standard that we reach for quite often for poverty measures, those are done at a data zone level, but those can mask people in different areas which are not classed as deprived areas where there is poverty. So it's a complex picture, but we've got lots of data, and we can use that in the way that's most appropriate in any particular circumstance to analyse it.
Thank you very much. I have 2.5 more questions. The half is because it'll depend on the answer to the other ones. Thanks very much for that. That was really helpful, because one of the things that's always stood out as a gap for me is quite often we talk about child poverty, and rightly so, and it instantly begs the question about what about the rest of the population. I'd like to move on to Michelle also mentioned the work that's been done around income maximisation. One of the challenges, and I speak from personal experience, but one of the challenges around trying to enter the workforce in the first place is, particularly if you have additional personal challenges, are the costs of working to earn a living. So it's almost a bit like the tail wagging the dog, that there are costs to get into work, there are costs to work before you then earn an income. And there are national schemes, particularly if you do have additional challenges, whereby employers can be supported to meet some of those costs. I'm just wondering, do we include that as part of the income maximisation work that we do?
That's a very good question, because when I heard for positive destination, I do kind of object, saying that a lot of positive destination which don't feel very positive for the person who went through it for exact reason that Hussein talked about. Michelle?
I think there are a broad range of services that are provided from the council and also our third sector organisation. So I know particularly in some of the charities that support people with money advice and income maximisation will also be able to offer support in terms of clothing for interviews, travel to interviews, and so a kind of broader support around that. I think that is the point that I was making in my presentation, that I think that service that is offered is different across providers, and there does need to be better coordination of that so that there's a consistent offer across public and third sector providers in terms of what financial inclusion and income maximisation looks like to offer those wider supports. I don't think that's something that we've got an absolute grasp of. We know that there are many different providers in the area, so that's definitely a priority for us to do better coordination and then to be able to promote that support that is available.
Thanks very much, and thank you for listing some of those initiatives at a local level as well that I wasn't aware of. Perhaps one of the biggest national schemes is, of course, Access to Work. And I sometimes wonder how many employers, particularly if they're considering improving the diversity of their workforce, are actually aware that that support is available. And the same for those who don't want to take a traditional route into employment. Can I move on to Gillian, if I may? And it's more a comment than a question, but you mentioned the very start of your presentation, you talked about that difference between people being in charge of their health and people having information and advice on how to manage their health. And access to high quality information, perhaps more than ever, has become a really critical point. There was coverage on the news just yesterday about the work that's now going on around high and ultra high processed food. You've only to spend a little bit of time in taxis, as I do, or more than a little actually, to see how much time particularly young people are spending on YouTube and TikTok. So I guess my comment is just around making sure, again, do we have data around where people are accessing their information? And also, what can we do to make sure that, given the media landscape nowadays and the changing landscape of how people access media and how people are influenced by media, that they are getting the information they need from respected, non-harmful sources? I'll stop just in case there was anything you wanted to say.
Well, thank you for that. And when I was reading through it's actually Health Foundation stuff about the way that they changed the way people think about their health and the choices that they make, whether they're individual choices or whether they're choices that you make because health is a collective resource. So thinking about the wider economy, and there's some really good examples, and I think this is something we should learn from. We kind of try to do a little bit of it, but we could do more in changing the way we communicate about health. So it's not just about throwing stats at people, and I know you know that. But if you think about things like frameworks, remember frameworks, Susan? This is it's a great tool to help people understand context, what it means for them, and start to open their minds to other possibilities. It's been used as a tool particularly around social determinants of health, actually. And I think it may be something that we should revisit ourselves. Because for me, I know that, and we know this, that through community planning, people say that they want more data, but actually giving them more data isn't in itself going to change things. And you've got to be careful about overwhelming people with too much. So it is about the story that you tell, the benefit that you can get from thinking about what this might mean for you. And I think using frameworks as a tool might be a good start for us.
Absolutely, and it ties in so well with that prevention agenda and early intervention agenda. My half question, which is more a half comment now, forgive me, Chair, I missed if you note any declarations of interest in these meetings, just in case you do, and perhaps even if you don't, given that there have been a number of references to mental health and parts of the mental health strategy, I just want to make my now usual transparency statement. I'm a member of the Diverse Experiences Advisory Panel, which is a named partner in the Scottish Government's Mental Health and Wellbeing Strategy, and I'm also the lived experience representative on the Scottish Government's Mental Health and Wellbeing Leadership Board. Thank you.
Thanks very much, Susan. We don't do generally this because we will have a lot to declare, all of us. I think it will take us half an hour just to go on declaration of interest. Susan, you wanted to?
Yeah, just I guess a couple of things to add in. I'll start with the last first. So Gillian's comment about where do we get our information? I guess one of the things that we need to be mindful of are the risks and opportunities provided by artificial intelligence. And this is something that has been brought up at a national level because with it being such an emerging field, I think it is important that we have national resources behind understanding both the risks and opportunities, and that we're able to make the most of those in terms of getting evidence-informed data out. The second bit that I was just going to add, and it was from the NHS perspective to support Michelle's comments. So one of the things that we have done as part of our anchor organisation work is have focus groups with those that work within our domestic services to get some feedback on our process in terms of how we support individuals into the workplace. And anyone who has applied for a job in the NHS just knows how tricky some of the application forms and the IT systems are to navigate. So we've had some incredibly helpful feedback. So I guess my suggestion is, Hussein, that there is something about how we simplify a lot of what we do, because that will benefit the majority.
Yeah, I think that's an important point to make. Thank you very much for this, Susan. Any other comments online? Or? Yes. Yep.
Sorry, Chair. It was just to follow up on Hussein's point about where people get trusted information on obesity from, or healthy diets and lifestyles. That's something that Alison covered in her presentation as a priority in terms of the whole system approach to obesity. So whole system approaches are moving away from that individual responsibility. And there's a great quote that Dr. Danny Rutter always refers to about it's not an abnormal reaction for people to gain weight in the last sort of 20, 30 years. It's a normal reaction to an abnormal environment. So as part of a whole system approach, it's not just focusing on diet and physical exercise. It's looking at marketing, it's looking at planning, it's looking at communications where people get trusted information. So that's something that the whole system approach to obesity, which is already underway in Aberdeen City, is looking at.
I like to hear about healthy weight as opposed to the O word. which is important to try to go in that positive destination. Susan, you wanted?
Yeah, so I mean, really enjoyed the presentations, and I guess trying to make connects as we go through it. I guess I was struck by there are a number of common actions in the different themes. So thinking around social prescribing and the potential of addressing social isolation. We've got smoking in a couple, and I guess it would be good to think through how those overlap in reality. It's like having the pillars, but how do they come together? We touched on the whole family support, but again, I wonder if we've moved away from the adverse childhood experiences and how we pull that together, because there was reference to some of those but not others. So again, just wondering how we are working together to wrap around families, whether that's through a young person's lens or through an older person's lens. My final couple of comments. One, there's quite a lot of behaviours in the actions, so physical activity, but it's also to make a plea for the importance of the arts as well. So yeah, cycling's great, but going out to museums and art galleries is equally good for tackling some of the things that we're trying to tackle. And the final bit was just to say the population health framework also has a number of evidence reviews attached to that, so that might be helpful in the process that you've outlined. Thanks.
I think that's interesting. Something I wanted to add as well, we talked about data. Mr. Martin will maybe surprised at what I'm going to say. I'm not so attached on data. What I want to know, and that's what we call for of us as partners, is to see the trend, which is maybe more important than the data itself, is where we were, where we at, and where we want to be. And that's maybe is maybe more valuable than knowing a data, one data at a time, which doesn't tell us a lot at the end of the day. We want Councillor Blake first.
Thank you. I guess my question around the priorities, I think one of the things that I thought came quite strongly through in the public engagement document was about public transport and people's views about public transport and the importance of having a good network. And that also came through in the Scottish Women's Budget Group report as part, actually very strongly as part of the cost of living, the fact, the amount of time people were spending trying to get their kids to school or to a nursery as well. And I guess I didn't really feel that came that strongly through in the priorities. And I just wondered if there was any thought around that, because I thought it was quite obvious in the public engagement one, and then it chimed very well with the Scottish Women's Budget Group. So I just was wondering if there's any thoughts about that.
Yes.
When we looked at place through a climate lens and we were thinking 2045, we had the Manchester bus system in Aberdeen. And we really firmly believe we're looking at something like that, something which is publicly owned, cheap and accessible, and part of how we get about. We talked about it at the management group, didn't we? We talked about how can we use community planning to influence something which feels begging out with our responsibility. So it's on the horizon. I hope it's a nearer horizon than a far horizon. But you gave some thoughts about how we could work nationally through community planning on that. Do you remember that conversation, or you don't remember it? Well, you did. It was a nice answer. But I mean, because working at a community level can sometimes feel so far away from what you're trying to do regionally or nationally. But I think your answer was don't be put off by that. There are mechanisms through community planning, national community planning you were talking about, where we might be able to do something. Go on, pick up on that and tell us what you were thinking. It's definitely on our horizon.
if only Councillor Blake, I could recall the conversation. Gillian's making me sound more coherent than I probably was in the management group. So thank you for that. But I mean, I guess to your fundamental point, Councillor Blake, what we're keen to do through the CPP and the LOIP is the additionality of the partnership. So the LOIP will never repeat what the single agencies are doing. And as you know, Council is doing a huge amount of work around transport, public transport, local transport strategy. Colleagues are working on that, Aberdeen rapid transport and so on. So those kind of big interventions are already kind of coming through the single agency system of Council. What the LOIP attempts to do is to really focus about additionality. And I think Gillian's quite right, and to Susan's point, there's a lot of what we're attempting to do as a collective is about influencing behaviours. So whether it's in the context of transport or whether it's in the context of families, everything is about influencing behaviours and also trying to tackle stigma within that. So I think we've got to think about within the interventions that we put forward as a CPP, it's not just thinking about some of those single agency activity, but thinking about the collective partnership and how the collective partnership can influence all of the required behaviour change that are all linked into many of the behaviours and the outcomes that we're seeing. So at pains to make sure that the LOIP doesn't repeat all the single agency strategies and plans, but that we focus on that additionality. And I think in terms of transport, there's certainly a big behavioural piece in there. And I think we do need to think about the capability that the partnership needs access to. And again, we've done some work, and Mr. Murchie might want to say a wee bit more about it, but we've certainly been looking at around skills and knowledge for influencing behaviour and how, as a set of public servants, how we can add that to our skill set to be more effective and influence behaviour change. But I'm just frantically, Councillor Blake, as I'm answering that, just trying to recall that conversation. I hope I haven't departed from what I maybe said more coherently in the management group than I've managed to do here.
Thanks, Angela. I think it's got a point. Both of us go to critical mass, for example, every last Friday of the month. Yeah, no, I'm not going every time, but to try to find other different forums, different ways of communicating and showing an example of other ways to travel, whatever is walking, cycling, and others, or public transport. I wonder if we are maybe a bit guilty, all our institutions, to maybe only repeat the national vocabulary, as opposed to try to make our own more local appeal, something which maybe will resonate better with the people of Aberdeen. It's maybe a challenge for us, maybe to have our own way to formulate what does it mean for the people of Aberdeen. I do think that from time to time, repeating the message coming from nationally doesn't help a lot. A challenge.
To your point, Councillor Allard, I think it's a very good one about our corporate speak and our corporate language, and you're consistently reminding us of that. And I do think you are right about what people connect with. You've sometimes seen some national strategies. I remember there was one about baccies and how the baccies were how children played, and it was framed into national strategy. So there is something, you're quite right about how we take our corporate language and make it more real and connected for people's lives. So again, I think that's, it's a good challenge for us to think about, even in the presentation of the LOIP. Again, it has to serve a purpose to enable our governors to hold us to account for it, but you're consistently right about as a public communication document. So is there something that in our presentation of it we need to think about versus serving our need as a set of officials? So happy to take that into the discussion in the management group. And again, for council colleagues, I mean, there'll be, and again for health and social care partnership, we've recently been trying to present our strategies and plans using personas, real life, making the issues centred around people's everyday experience of living in this city. So again, I think there's something for us to perhaps take from. I think we've taken a wee bit more confidence in the use of it because we've had some good positive feedback from the public, both on the IGB consultation and on the council's housing strategy. So happy again to think about how we could maybe use some of that in the presentation around the like to tackle the point that you're raising, Councillor Allard.
Yeah, if you could put that in the local improvement, outcome improvement plan, it would be a good idea, yes. We had Mananda, yes.
Thank you. I really welcome the presentation. I think it was excellent. Looking specifically around sort of the health and well-being side of things, I'm not seeing much around sort of health literacy and people being able to understand the information that they're knowing where to go get information, then being able to understand the information that they're getting and then being able to apply it to their lives. And I wonder if we're missing a trick there, you know, that sort of ability to self-advocate as well. We see it, we see people's ability to self-advocate diminishing over the past few years. Specifically, you know, we have challenges in housing, we have challenges across sort of all of our disciplines. And I wonder if there's something that can be explored there. I don't know what the answer is, but it's not something that we have picked up on through that presentation. Specifically, health literacy was one that I picked up on, that ability to know where to get information and then apply it to your life. But it is a wider conversation that I'm not sure we're quite there with. Sorry to leave that challenge.
Thank you. I'll take that one. It didn't come through as an emerging priority from that particular exercise, but it's absolutely something we're completely aware of in the Health and Social Care Partnership. And as Angela alluded to, we're developing our strategic plan at the minute, and accessing information about where you can get health, how to access health care and social care. It is part of that, and we're looking at particularly for younger people, young families, etc. Maybe normally use their whole life is on their phone. So you know, how can we make that easier? You know, we're looking at an app. You know, how can we make it easier for people to get information and to understand it? Absolutely. So it is on our agenda, although you didn't see it in the presentation. It's absolutely part of what we're thinking about.
Yeah, changing our language is important. You know, how we are more visual and more adapted to a mobile communication, which is now. And not forgetting there are still people who will not be able to read or write. You know, we are meeting there's people, whatever they come from, different background or different countries with different languages. We need to be able to. It's one of the gaps. You know, when we're talking about gaps, is actually how we can model all our services and all our support for everyone. Yes.
I'd make one point just around what yourself and Hussein were saying around sustained positive destinations, and I think there needs to be a recognition that is not always work. A positive destination is that we put a lot of importance into work, but actually there are some people who will never access work for whatever reason. But a positive destination is that a positive destination. It doesn't always equal work.
I was stigmatizing people by saying if you're never going to reach that positive destination, we are giving something that some people will never able to reach. You want to add something?
Yeah, it's interesting. This debate was actually going on in the Highland Council community plan exactly the same point, and it was a bit back and forth. It was quite interesting. I mean, Skills Development Scotland does a lot of the stuff around positive destinations, and we work to set a criteria that Scottish Government lay out. So you're right, it's not all about work. There's any number of things, but the other thing as well is it doesn't stop once they get into a destination. There's people work with people, so sometimes there was a query raised whether working in a retail tartan shop was a positive destination in Highland, and obviously, you know, for a school leaver, 16, 17-year-old, and some people thought it wasn't, some people thought it was. but it's a start. So there's a debate that goes on there. But just going back to the presentation, I thought it was really good. From my perspective, obviously, we play into all of it, but particularly within the economic stability and the children and young people part of it, I think they look spot on. I'll be honest with you. And I would say you've got some key organisations. So this thing about collaborating and working together, the Local Employability Partnership, the LEPs, as they're called, all need to improve, right? But they are going to try and do some of what we try and set out here. I think things around employability support for priority groups or positive destinations, trying to target work more effectively in priority neighbourhoods. That's part of what they should be doing. Care experience people with disabilities, ASN. That should be what they're doing. I think what they do have is they have a lot of data. It goes back to this data point, and they need to use it better to make decisions. And that's the idea, is we've got a lot of stuff. So do we understand the stuff, and how are we going to use it to make decisions? And so I think we're on the right lines, and I think some of this is happening, but it's not one agency's job to do it all. It's your point, Angela. It's only worthwhile if all the people come together doing it. So I think it's really good, the priority areas that you've got.
Good. It seems to be a very positive engagement. I might add something. We were talking about that. We were talking about 10%, 10 times high of drug related death in regeneration areas. And, I've challenged that before, and I would like to, when we have a data like this, to have a re-asterisk and putting something, generally speaking, a lot of people who have addiction problem end up in our regeneration areas, even if we, the best will of the world, we're trying to disperse as much as possible. There is people who ended up having an addiction, a drug addiction, will end up in the regeneration area. So we have to be careful about that. It's how we maybe comment a bit better about what the data means. So that's an example of them. So I would encourage not only to look at the trend, but also having a little explanation about what it means, as opposed to concluding, I'm living in a regeneration area, therefore I'm more likely to have a drug addiction problem. Not saying it's right or it's wrong, but we need to balance that with the idea that people with drug addiction are more likely to end up in these areas. So it's how we balance all this in our understanding, which is not as easy as we think it is. Any other comments?
Yeah, just coming again. I'm looking at a report here. This is interesting. This is data again, and I think there's another emerging thing, which is over the last 10 years, well, 2014 to 2024, the number of the regional employment level has declined by 7% in this area in Aberdeen City. That's more than any other area of Scotland. I think that's quite interesting, and that's not about unemployment's growing. That's about people leaving the region, or more people are becoming out with working age, retiring, for example. And that's a particular issue going on in the Highlands and Islands, but it's emerging here. And if you look over, the STS has done some projections up to 2034. So there's currently 266,000 people in the workforce, working age in Aberdeen City and Shire, to be honest. It's going to go down to 2061. It's going to drop by a further 2.5%. When the trend in the rest of Scotland is it's going to increase by 1.2. So we need to get under what that's about. There's a whole range of factors, whether it's Brexit, retirement, people leaving, young people going away, not coming back, unemployment. There's a whole range of it. I think we need to look at that, because that's a little bit of a sign, I think.
You heard what the answer from Michelle was: the diversification of our economy. It's absolutely a priority. It's not only a just transition, it's also diversification of our economy. I might have a comments from Kate online as well for Police Scotland, just to understand a little bit better. We talked about our young people, and we talked about smoking. That is the legislation just changed the 1st of June about disposable vaping. I just want to know how everybody, Police Scotland first, but everybody think about what should be our approach regarding vaping, with smoking, and how we can stop that increase that we heard about, and what action can we take? Is it part of our priorities? I don't know if Kate is still there.
Happy to talk about it from a health point of view. I mean, this is very much part of our world. And right now, I mean, our focus is very much on children and vaping. Some of our behavioural science work is about really getting in around very young people in primary schools to stop them starting from vaping in the first place. It's so hard to do. We really have had challenges trying to do this from an information governance perspective, trying to capture data. It's been really challenging. But that's where we ought to go. That's where we should be heading. And we're doing plenty with people in the older ages in primary school to try to understand what makes them start, about their home circumstances, all of that, as well as all of the commercial bits as well, where you buy, the effect on the environment, and tapping into things which might help them reconsider. But I know certainly working in the group that I'm with, trying to tackle it from stop people from starting in the first place is absolutely key, and that can be as young as P4, really young. And we're finding that a lot of P4s are starting to show the signs of thinking about starting. So my plea is around the sharing of information and the governance around that. We've had some challenges, to say, working in each of our respective councils to be able to do that. But it is on our job list.
Thank you, Diana. It's really important, I think, that everybody will speak on the same voice on this and making sure that we use the same vocabulary around it, because it's not only our young people, it's parents, it's the shopkeepers, it's but it's all a society around there. A last point I don't want to take is what Graham was talking about, which is an important part about how we help fathers, better, having a different approach in parenting. And we know with social media, like Hussein was talking about, best changing and social media was pushing very much boys to be boys and forgetting about that role model, very different of the role model that we had the last 10 years, who were trying to get boys being a lot more involved into society, in day-to-day society. Have we got the right action in place? It's for parenting, but it's also all the responsibility that we would like our young people to take and to understand what their role in society are, whatever they are, boys or girls, men or women. How do we encapsulate all this? And are every agencies, all our partners working on this?
Thank you, Chair. I'm not sure I'm able to answer the question specifically whether we have the right supports and actions in place to address that, but I think there is growing recognition that actually, if we're not actually thinking about how we make it easier for fathers to access services and supports that prepares them for parenthood, then they're often walking into that role blindly. There has been a couple of pilots and projects in Dundee and Glasgow which has specifically focused on dads and actually just in recognising that actually this is often about a lack of confidence, a lack of self-belief around what it is they actually bring to the role, and actually it's also about actually enabling them to connect with other fathers in that same place as well, who this is quite normal to feel a bit out of your depth, a bit uncertain as to what you need to do. So I'm happy to pick that conversation up with colleagues and thinking about how do we begin to prepare that. You're absolutely right about the whole issue around misogyny within our curriculum and within our thinking. It is certainly something that is very visible on the school planning around that as well, and I think we need to continue to sort of push that hard to combat some of the negative sort of articles and messaging that's happening online as well. But I certainly think it's a big challenge, and there's no point in pretending otherwise. But absolutely, it's something that is absolutely on our horizon.
Yeah, I for one would welcome any pilot, because we have something in Aberdeen that, but it's an open door. We've got a lot of fathers who are there 2 weeks on, 2 weeks off. So during the 2 weeks off, they take a role of parenting, and I'm sure, as you said, they would welcome a lot better understanding of what their role as parents should be. Yes, Amanda.
I guess this, again, I may be out with the scope of this sort of exercise, but we focus a lot on maternal health, but actually paternal health has a huge impact on the health of the child as well. I am starting to see that sort of filter through social media, filter through the sort of platforms that I engage with. But I guess what work is being, or what work potentially could be undertaken around the importance of good paternal health on the child as well, because we do focus quite significantly on maternal health, but there's two parents in that equation.
Just as one of building on that, just a little bit, Chair, that one of the improvement projects within the Stretch Outcome 5 is around the expanded role of the Family Nurse Partnership, which has taken on a focus on care experienced parents and recognising they will often not have lots of lived experience, or positive lived experiences rather, to draw upon, and that has not discriminated between. It's not just focused on care experienced girls, it's also focused on care experienced boys that are thinking about how do they influence on all of that. So I think there is something in what you say, Miranda, in terms of how do we scale that up, or actually take some of the learning from that to make it much more publicly accessible.
Thanks very much, Graham. Anybody else wants to add anything? Anybody online who want to have a comment to make, or thanking as well as the excellent report that we got in front of us? So we're quite happy with the question which we were asked, that we'd fulfill all the gaps what we thought it would, and we're quite happy as well. We are content with the proposed next steps, and I think it's going to take some time anyway, because we are really starting next year, to be fair. Okay, well, thanks very much everyone for this discussion, and St. Patois didn't disappoint us, despite a very low expectation. Fulfill it very quickly. We'll go, if we all agree on this, we'll go to the next item agenda, which will be 3.1, which is making Aberdeen City and Aberdeenshire living wage place 2025 to 28 action plans, and it's Martin Barry. Up to you.
Thank you, Chair, and good afternoon, everyone. Thank you for the time on the agenda this afternoon to discuss this. As I said earlier, I'm Martin Barry. I work within the Scottish Enterprise team based here in Aberdeen. I'm here in my role as co-chair of the Aberdeen Real Living Wage Action Group, and soon to be Aberdeen and Aberdeenshire Real Living Wage Group. So I'm here to present the regional Real Living Wage Action Plan today, seeking endorsement of the Community Planning Aberdeen Board for that. And it's just worth emphasising before we go on that it's the real living wage that we're discussing today, rather than the UK Government National Living Wage. Councillor Ireland.
I have to tell, what is supposed with the title? You forgot the word real.
Thank you. So yeah, I've led the Living Wage Place project in the city here for quite a few years now, taking it from an improvement project into the Living Wage Places scheme. But it's always been our ambition to extend this into Aberdeenshire at the appropriate time. The Living Wage Places scheme is administered by Living Wage Scotland. And one of the conditions for joining that is that the relevant local authority has to be an accredited living wage employer. Aberdeen City Council have been an accredited employer, I think, since 2017. Aberdeenshire Council achieved that back in October 2023, so that allowed us to move forward with these regional proposals. And I think it's important we do that because, there are very strong two-way flows of workers into the city and the Shire. But although it's a regional plan, it's still very relevant to the city, and will support the objectives of Community Planning Aberdeen and the LOIP, obviously specifically in terms of Stretch Outcome 2, increasing the number of people in sustained and fair work. It's probably at this point I should say that we'll also support the Living Hours scheme within this action plan, which also looks to ensure security of hours for workers alongside the real living wage. I think it also supports other outcomes in the LOIP, particularly around poverty reduction. And I don't need to tell you the stats around child poverty in Aberdeen. I know you were discussing that when I came into the room, but I think 2/3 of children who live in poverty are from a household where at least one adult is in paid employment. I think that lays bare the impact of low pay. And my view is, if work isn't a route out of poverty, then what is? So this is a key driver of this, reducing in-work poverty. And the real living wage is a very important tool in this. And you'll have read some of the quotes within the action plan about the impact the real living wage has had in helping individuals with their finances. But it also helps in terms of health and well-being. Clearly there's benefits to mental health through the reduction of stress. Receiving a decent wage and not having to worry so much about their finances and paying bills, unexpected costs, etc. But just going back to the regional aspect, just about the regional economic strategy has a stated objective of 95% of all employment offering a real living wage or higher. And this action plan will be a key mechanism in helping to support that. I think, as I said before, there's a large travel to work area, and engagement with employers both in the city and Aberdeenshire will benefit workers in both council and community planning partnership areas. So there is an action group to deliver the plan. There's a public, private and third sector representation, very strong third sector representation in the city. We're looking to strengthen private sector representation and of course look to broaden out the Aberdeenshire aspect of that. But I do feel this project is a very good route to get the private sector engaged in community planning. And I think that's something this project really brings. I think it's true partnership working across public, private and third sector that can help tackle poverty and improve quality of life. There's several organisations around the table, and on screen are members of the action group, and I think not all, most are accredited employers. If you're not, you'll be getting a knock on the door soon from myself or Councillor Allard, I'm sure. But I'm happy to answer any questions if I can. And as I said, we're seeking endorsement of this plan, and we'd be looking to formally launch this in the next week or so. Sure.
Thanks very much. And I'm very impressed being member of the group. I know how it's important to have the chair being coming from private businesses, and it's important the best people to convince other people to go to pay the real living wage and to go through the accreditation. It's businesses themselves talking to businesses, and that works the best. Any comment or question? Yeah, Sam.
Thank you very much, Chair. The first point is a bit of knowledge for myself, so apologies for those of you that might already know this. I'm just wondering, what is the accreditation process? How labour intensive or cost intensive is that? And the reason for asking is directly related to my second question around smaller employers. But could you maybe just give me, if you wouldn't mind, a very quick rundown as to what accreditation involves if someone decides to take that step?
Yeah, absolutely. The accreditation process is run through Living Wage Scotland. I haven't been through the accreditation process myself, but I'm led to believe from employers that it is a very straightforward process. There may be some around the table who can comment better than I can. There is a sliding scale as an accreditation fee for employers, obviously in terms of small, medium, large employers. I don't have those exact figures with me, but I can get them to you if you would like. But Living Wage Scotland, they're a fantastic team. They're there to help the employers. And to be perfectly honest, I haven't actually heard any complaints about the accreditation process. I think it is quite a smooth and straightforward process.
The reason for my asking and where I'm going with this is it's great to see the increase in numbers of employers. And I'm very supportive of the fact that we're now taking a cross-border, as in cross-local authority, cross-regional approach to this. I think that makes sense given the nature of travel within Aberdeenshire and Aberdeen City for employers and employees. The reason I asked my first question was looking at what you might term micro-employers. So those who are maybe self-employed themselves, do not have a limited company and employ somebody. And Chair, if you'll forgive me just going slightly off on a tangent just to give some context on this. I had a very interesting discussion with somebody from Self-Directed Support Scotland at a conference 2 weeks ago. And we were talking about employing support workers or personal assistants. And we got onto the topic of the remuneration for that. And, you know, speaking from my own experience, having just recently had to put in funding requests, I was very keen to say support workers should be paid the real living wage. It's the right thing to do, and it keeps up with the current prevailing standard that we're looking to set. Where I'm going with this in a very roundabout way is, what are we doing to maybe encourage those micro employers, those one-person businesses, 1 or 2 person businesses who want to employ people, particularly in sectors like caring, support workers, personal assistants, drivers, those kind of roles that are not larger businesses, but to encourage them to maybe seek accreditation as well in order to perhaps drive the whole sector from both ends. So not only from the top level with our commissioning, and I know we do excellent work around commissioning, but also that grassroots level as well, for someone to say, I want to be able to pay somebody a real living wage, and also then driving that through some of the national processes around the funding for that, where people are maybe claiming funding to employ people, and they want to be able to say, I want funding that is at a level of a real living wage or higher. So I hope that's helpful. But I just felt it'd be helpful to put some context around that.
Yeah, actually, no, absolutely. That's very fair comment. I mean, Living Wage Scotland do work very closely with all employers, and you know, in terms of the costs, you know, I think that's obviously a key issue at the moment across all sectors. You know, particularly in the third sector, you know, we're hearing the word existential a lot. You know, when we're talking about costs, and you know, yeah, I mean, there's a huge range of employers. So we've got multinational organisations right down to micro employers who are accredited, and I think that's one of the great things about this scheme. And you know, certainly Living Wage Scotland would look to work if there was an employer who was to say, like, when we do have these conversations where employers say, look, morally, I would like to pay the real living wage, but yeah, I can't afford it at the moment. Living Wage Scotland would work with that employer to hopefully get them to a stage where they could sustainably, you know, accredit and pay the real living wage. I know they've worked with employers for years to get to that stage. And of course, if you know we are looking at kind of sole traders, we would of course look to work with them as well, because we would look for them to kind of grow, you know, over the years and take on staff as well.
So I suppose just to extend that point ever so slightly, then with maybe a sort of a more quantifiable question, have you or have the kind of umbrella body had discussions with, for example, the likes of Social Security Scotland or the Department of Work and Pensions, who quite often fund some of these micro employers who themselves are in these very specific roles around caring and support, whereby the decision of what rate they pay is often not in the gift of the employer, but it is in the employer's gift to be able to put in an application and say, this is how much funding support I need. So it's almost as if getting, I suppose, indirectly the state, whether that's UK or Scottish government, to support anybody who came to them and say, no, I know for the last whatever years I've paid this, I'm now seeking funding from the state to pay my employee this living wage. So that then there's that kind of bi-directional support to say, yes, we see where you're coming from. Yes, that's a perfectly reasonable ask. And yes, we will support you in doing so.
So I guess within the kind of local action group, we haven't had these conversations. These will be taken at the kind of strategic level with Living Wage Scotland. Social Security Scotland are an accredited employer. So I probably can't answer your question right now, but I can go back to Living Wage Scotland to get them to find out if these discussions are being had, and certainly get back to you with the information.
Yeah, thank you very much for the question, Hussein. And I think it will be important maybe for both of you to maybe have a meeting and having a better understanding. And as well, how Hussein can maybe help us as a group moving this forward. Because I do know, Martin, that recently there's been some question mark about the real living wage. Is it something positive, or is it an hindrance for people to recruit more people, etc., etc.? So we have to find a best way to articulate that and maybe to respond of some of the worries that people might have. Any other questions or comment online? Yeah.
Thank you. Yeah, so obviously we got the chance to read this report for anti-poverty in an inequality committee the other week, and one of the things I'd asked about was engagement with business networks, because I know you just said that there was a private sector employer on the steering group. In the report itself, it didn't actually look like that was the case, so maybe that somebody has been added in. But I was just keen to understand, the engagement with the Responsible Business Network came through in the report, but organisations like the Federation of Small Businesses or the Chamber of Commerce, how are they engaging with this, and are they likely to, are they people that might engage with the steering group itself? And I've got one other question I was going to ask. So 1.5 of the action plan, so is the intention it was talking about supply chains, is the intention then to put that into the procurement of services that you would be looking to only take on people who sign up to the real living wage? Is that what we're thinking there? Thank you.
Thank you. So, I mean, in terms of the private sector, we've had a private sector rep for a couple of years now, and indeed was actually co-chair of the group till relatively recently. He's had to step back from that role just due to his business commitments. But I'm hopeful we may have an additional private sector rep in the coming weeks. And I said, certainly we will look to bolster them in Aberdeenshire and in the city as well. The Chamber of Commerce are an accredited employer, and have relatively pretty recent, frequent conversations with Russell, and they actually helped us out last year at Living Wage Week by giving us a free spread in the quarterly bulletin. We utilised their communications network to help spread some of our messages as well, and chat frequently with Mike Duncan at the Federation of Small Businesses, and he does what he can to support as well. In terms of procurement, we do have the joint procurement service around the action group table, so I know they look to kind of embed this into kind of procurement services as best they can.
Thank you. And Matt Lockley wants to come in online.
Yeah, thanks, Chair. Thanks, Martin. A really positive report, I think. And I think, if we can get this established across the region, all the better. And the regional economic strategy ambition is really helpful in that regard. I've just got a couple of questions about the living hours part of this, because I think that's a really interesting kind of further iteration of the whole kind of programme. But a couple of questions. One's a kind of technical one. So is that a separate formal accreditation, and does it therefore have another cost to the business of doing that? That was my first question. But I suppose my second question is a bit more theoretical in some ways, in terms of, do you think in future these two things will be wrapped in together, living hours and real living wage, as a kind of complete package? And are there any kind of risks or issues for that in terms of trying to encourage smaller businesses, micro businesses to kind of sign up to the real living wage? Because the living hours thing, I guess, might be slightly more difficult for those smaller and micro businesses or whatever. So just interested to get your thoughts on that.
Yeah, thanks, Matt. It's always difficult when your boss asks you a question as well. Yeah, so the living wage hours scheme is relatively recent. It's quite new, so we only have a couple of employers who have accredited to that within the city, so CFINE and Four Pillars. Yeah, I mean, basically it does build upon the existing living wage accreditation. So basically employers who join the scheme could have just looking at the action plan here. So at least 4 weeks notice for every shift, with guaranteed payment if shifts are cancelled within that period. The key thing is a guaranteed minimum of 16 working hours every week, unless the actual worker requests otherwise, and a contract that accurately reflects hours worked. There's been no word of it being kind of all wrapped into one mat. But of course, one thing we do have to, I mean, it's a live action plan, and one thing we do have to be aware of is that, you know, things are changing. When the action plan was published in 2022, I think everyone used to say, what's the world going to look like this time next year? I think at the moment, we say, what's the world going to look like this time next week? You know, there's lots of, you know, policy changes. We've obviously got elections next year, and the landscape could change. So we'll have to be adaptable and flexible to changes that are coming in. You know, Living Wage Scotland will be no different to any other organisation, I presume, in terms of that. So yeah, I mean, no official plans as yet to merge all of this, but you know, certainly something we'd be kind of looking to encourage. But you know, we have to be aware of the pressures facing employers across all sectors. As I said, you know, we can't be the living wage or living hours police. We have to be, you know, very cognizant of the pressures they're all facing at the moment.
Okay, thanks, Martin.
Thank you, everyone. If there's no more question, are we? Oh, Susan, sorry.
It's just to say, really welcome the report and action plan. I guess having gone to an event around this, speaking to employers themselves was really positive, and I didn't see that reflected in the action plan. But equally chatting to them and understanding some of the things they've changed. So the example of shifts that are offered to make them, in a particular cleaning company, make the shifts in the evening so that their employees could have dinner with their family was really important, and actually contributes to the wider community planning agenda. So for me, in these reports, it'd be really helpful to share some of the wider benefits that this has and that employers themselves are highlighting. But thank you.
Yeah, that's something we want to do in our comms going forward. You know, I think, you know, for me as a public officer, going out and I can go out and promote it, you know, and raise awareness of it. But you know, the real, you know, the increases, you know, in terms of accreditations and uplift come from employers speaking to employers, because they understand, you know, the bottom line and the impacts on the running of their business or organisation. But you know, I talk about accreditations, but you know, they're the cherry on top of the cake. It's the uplifts that are really important, and the number of people who are actually receiving those wage uplifts, and we really want to kind of start getting the benefits of that, of the individuals, you know, who are receiving these uplifts, because I think that's a really important message. It's great to say the benefits to business and to employers, but it's the people who are receiving the uplifts who are getting the real benefit from it. So that's why we included these quotes in the action plan, and we want to do some more about that, some case studies, and we have Station House media units around our table. We're hopeful maybe to utilise that in the community newsletters to start building up a bit of a portfolio of case studies.
Absolutely, real benefits, real living wage, and of course, in Aberdeen and Aberdeenshire, we know what's one of the problems employers are facing the most is recruitment. So having real living wage help a lot the recruitment process. It makes it a lot easier to attract people working for you, and we all know that as partners. So if you're all happy, no more question online or in the room. The recommendation are that we endorse the Making Aberdeen and Aberdeenshire Living Wage Place Action Plan, that we agree to continue supporting the delivery and promotion of the action plan via Community Planning Aberdeen communication channels, and thirdly, that we support the Real Living Wage Action Group in encouraging both living wage and living hour, I suppose. And happy to agree? Thank you very much. So we'll go to 3.2, which is draft committee planning budget 2025-2026. Michelle Crombie.
Happy just to answer any questions on this one. This is consistent with contributions from partners in previous years, so just looking for approval.
Okay, all our partners. Yes, Mr. Patel, you said.
Thank you very much, Chair. Again, just from my historic knowledge, I note the proportion of contributions from partners. I'm just wondering, obviously we're all under constraints, Chair, and resources. We all know those challenges. I'm just wondering if the proportion of contributions from each partner mirrors the proportionality in previous years. Is that a steady trend?
The amounts certainly mirror previous years. My understanding is that going into the distant past, there was at one point a formula that can't remember what the formula was, but there was a formula that sat behind the contributions. Over recent years, that has become something that's more voluntary and elected by the organisations, what they put forward. But I'm certainly happy to try and find the source of that original formula that was used back when this budget was first developed.
That will helpful, yes, I think, Susan.
Yeah, and it's just to say, as part of the population health framework, community planning partnerships are seen as absolutely key to delivery of the framework. I think there is a recognition that traditionally the bulk of support has come from local authority colleagues, and I think there is an intent that those contributions come from all partners around the table. I think one of the things I would caution against is always just looking at the money that comes in, because I know a number of partners do give support in kind, support from officers, and I think that's all important, because that's what makes community planning tick.
Absolutely. So all we want, making community planning tick. Are we happy to approve the recommendation on page 42? Yes. Thank you very much. 4.1 is for information only. You'll be pleased to hear. It's Community Planning Aberdeen Board information. So again, I've already done it. If you want to have any question you might want to ask, you can ask them online to Michelle or anybody else, and we can have a discussion on the other way if you're happy with that. It's been a long meeting, a great discussion. Thank you to Mr. Patois again being here today. Thank you for his contribution, and I'd have to say that Susan is leaving us. So if you want to say a few words before you leaving the vote.
Yeah, just to say that I've been absolutely delighted to be part of Community Planning Aberdeen. I think it is a really, really strong partnership. I think there's great support across the partners. I think today's agenda just demonstrates the difference that we are making when we pool our collective skills, experience, resources for the benefit of our population. But we know the job's not done, and I'm slightly envious I'm moving to an area that isn't part of the CHES work, because I think that provides Aberdeen City the opportunity to build on, whether it's the HDRC or the whole family approach, just to name a few. So I absolutely believe that Aberdeen City is really well positioned to achieve the intent both set out in the population health framework, but within our own LOIP, and wish you all the very best for the future. And I will be watching very closely, and I was going to say stealing as much as I can to take to the area that I'm moving to. So thank you very much.
Thank you very much, Susan. And I'd like to say that I very much appreciate the work that you're doing through it. You talked about the agenda. You helped shape this agenda, this changing of agenda, having more discussion and being able to open up the group a lot more. So I'll thank you for the time we spent here, and good luck for whatever happens next. On this, thanks everyone for coming today, and we'll see you at the next meeting. Thank you.
Thanks.